Welcome, 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 my Be Health Empowered family, to another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark. Of course, please call me Dr. Mel. I am delighted to be back here with y'all this week to cover all the wonderful topics that we do to help you make it an amazing health week. And if you're new and joining us for the first time, please hit that subscribe button if you're checking us out on YouTube. And if you are on Facebook watching, please go ahead and hit that like button. And of course, we are here to empower you with all the health information that you need to have and be empowered when it comes to your health, the health of your family, and even your community. And, therefore, we want to make sure that you're part of the conversation, that you're putting your concerns, your questions in the chat so that we can get to it as we move through our show. And for those of you who are in my Be Health Empowered family, to move through the show, we have to have my incredible co-hosts, Miss Lila Mays and Mr. Wayne Bruce. How y'all doing?
Hey, happy Monday.
Happy Monday. Hope y'all had a good weekend.
Incredible weekend. Incredible.
Yeah.
Good.
I spent it in a mansion and a yacht.
Come on now. Why you living large?
I'm large and I'm living.
You living large. You living large. Well, it's important. I hope everybody's keeping safe, keeping out of the heat, and also keeping safe from COVID because we're in a surge again.
We are. We really are. And no one really wants to talk about it. We're going to talk about it here today. It's not being covered on the media. People in the streets aren't really talking about it, but it is happening. A whole COVID surge.
Yeah, it got me scared to even sniffle. I'm sorry. Scared. I don't want, as a man, I don't want the COVIDs. Don't want them.
Right. I know you don't want COVIDs.
Right. And COVID is the last thing that people are trying to think about.
Right.
But we're going to hit it tonight because we have this amazing guest who's going to talk about the effects of COVID on men specifically and the male reproductive system. And I say every man and every woman should hear this episode.
They should hear it. You should pass this episode along because men, sex, and COVID, two of them are good. One of them not so good. Nobody's paying to go get COVID tests anymore. People just they don't even. Are we saying COVID affects sex though? Is that what?
You will have to stay tuned and share it with as many people as you know to be able to get that answer because we have an expert who's going to be breaking it down, and it's definitely what you want to hear.
Have everybody tap in. I'm excited.
Yeah.
Okay. Share.
Yeah.
But before we do, we got to go into the week that was in health and wellness.
Right. All right. What we got up there? All right, it's 3 going.
Right there. So look, everybody's talking about this. I've heard about it at least 3 times. What if we could cut our cancer risk almost in half? Isn't that what I've been hearing this week?
You have, because the American Cancer Society published a study that showed that 40% of all cancer deaths are directly tied to things that we have the power to affect, our lifestyle choices.
Wow. I'm pretty sure the first one we could cut off, the bat is cigarette smoke.
And you would be right. Yep, exactly. 1 in 4 deaths, cancer-related deaths, could be eliminated by cutting out cigarettes because it's linked to so many cancers, of the mouth, the throat, and of course the lungs.
Wow.
And bladder.
Wow. That's bad.
Yeah.
Isn't number 2 being overweight?
You got it. Yep. And that's especially true for women and cancers of the reproductive system, like the uterus and ovaries, and breast cancer, all closely related to being overweight. And then the other things on the list are physical inactivity. So being sedentary, you've heard, sitting is a new smoking, right?
Mm-hmm.
Right.
Diet, especially low intake of produce and high intake of ultra processed foods, especially processed meats, and alcohol, definitely on the list, as well as not getting the HPV vaccine,
Right.
which the HPV virus is related to warts, which then can also morph into cervical cancer.
Mhm.
So, not getting an HPV vaccine, which very few people are getting, it's offered now to teens,
Right.
that also is something that could be done to prevent cancers down the line.
And for Black people, we still die at a higher cancer rate. We die from cancer at a higher rate than our white counterparts.
You are exactly right. And that is regardless of whether your level of education, how much money you have as a Black person. So it's not even, just being a matter of being able to modify those lifestyle things that I talked about, or even getting to the doctor, although those things do clearly make a difference. And I highly encourage people to do that. But it's also, the levels of stressors, like dealing with racism and discrimination in society, that raise your stress levels, decrease your immune system, which is responsible for surveilling for cancers in your body and eliminating them. So, those high levels of stress, if they're not dealt with, can indirectly, lead to higher rates of cancer. And then also getting diagnosed later if you don't have access to care.
Right.
And
Right.
once you do get, diagnosed, less aggressive management, again, because of bias within the healthcare system. All those things are what lead to some of the discrepancies that we see between survival rates of Black people versus white people when they get cancer.
Couple things, Dr. Mel. What are called social determinants of health?
That's part of the list. Yes, absolutely.
I mean, I'm just
You got it. You must be hanging out with public health people. They
I'm
know all
hanging
about
out
that
with some
stuff.
people,
Yeah.
in the public, and they help.
Right, on the yacht and in the mansion
The yacht and the mansion,
as you live
mansion.
large.
Right. But you skipped over one thing, and it's our number 2 on the week that was, and that's alcohol causes cancers. So let's
Right.
drill down on that, because most people don't seem to know that. And I know I did not know it. And as a matter of fact, people out here preaching a little wine is good for the stomach every once in a while. What's going on?
Right. I mean, alcohol is so socially acceptable. It's an acceptable way to have fun, to deal with stress, to be social, to address your depression. I mean, all kinds of uses, dysfunctional and otherwise, across the board.
Mhm.
But what happens is our body can break alcohol down into a chemical called acetaldehyde, and that can be toxic to our DNA and to proteins in our body, and therefore lead to cancer. And there's certain ones that alcohol is associated with. That's cancer of the mouth, the esophagus, the liver, the colon, and the biggest one, which a lot of women don't know, is breast cancer.
Wow.
Almost
Wow.
1 in 5 breast cancers are alcohol related.
So is it
Wow.
heavy drinkers this cancer is happening to? Or
Well, even low to moderate amounts of drinking can raise cancer risk. But yes, the more you drink, the worse or the higher the risk is.
Okay.
now, some people think beer and wine aren't alcohol. Are they risky too, or are we just saying we need to cut them out altogether?
Well, I think moderation is the key. But for certain things like breast cancer, no safe amount of drinking exists that would, that diminishes risk. But if every person in the US stayed within the dietary guidelines for alcohol, there are dietary guidelines, it
Mhm.
would cut alcohol related cancers by 80%.
Wow.
So
80.
It's significant. Yeah.
That's great.
That is significant.
That is
wow. All right, I'm going to move on to number 3. What's up with lead and tampons? I have been hearing this in news stories all over social media this last week and the last several weeks that tampons, toxic metals are contained in tampons. Should women be concerned, Dr. Mel?
Well, it is true. There are actually 16 toxic metals, including lead, cadmium, arsenic, that were found in 30 different brands of 30 different tampons from 14 different brands. And there is no safe level of lead or arsenic for humans, right? But the jury is kind of still out because there's a lack of data on whether these chemicals are absorbed through the walls of the vagina. And if absorbed, is it actually causing health consequences? So it's unclear. But researchers are calling with an urgency, right, for testing tampons to see if there are indeed health effects.
Why are these metals in tampons in the first place, though?
So they kind of sneak their way in through raw materials that are used to make the tampons, like cotton, rayon, or water, because they do occur naturally in nature. But they also sometimes are added on purpose for antibacterial reasons or for odor control or for lubricants to help with insertion.
Okay, so should women just wear pads then?
Well, so disposable pads also have been shown to have these things called forever chemicals or PFAS that can disrupt your hormones. Again, though, the jury is out. More research is needed. It has not been proven that there's any cause, any relationship between pads and health concerns, but they do have these chemicals in them. But there are alternatives that exist that don't have any of these harmful substances like lead or the forever chemicals.
Okay, so alternatives, like I've been hearing about menstrual cups and discs, things that can be worn internally that collect rather than absorb. Period panties are all over social media. And reusable pads, sponge tampons made of natural sea sponges, and those can be washed. So there are some alternatives out there.
Right. Exactly. And the reusable pads are basically old school. That's what our grandmothers and mothers and use. So there's nothing new under the sun.
I'm gonna stay out of this part of this conversation.
Well, maybe we should maybe we should move on from the recap then.
We gonna move
because I think we have recapped all these wonderful topics which people need to know, but we have something else coming up, right?
Yeah, we got good. I can't even speak because y'all have talked about women's issues.
Yes,
so
we have.
It's downtown to talk about men's issues, but everybody should be involved in that. So we must go to our
what y'all think?
It wouldn't come up.
I just love that.
It wouldn't come up.
And what
Okay, so
this is going on this week?
Yeah, this week we asked the brothers if there was a birth control pill or shot, would they take it reliably? I asked several men out and about, and the men folks said, I didn't ask them reliably, Dr. Mel. I asked if there was something for them to take, would they take it? And they said yes, emphatically.
Really?
Absolutely yes. Now I think the caveat is the reliability.
Unanimously?
Yes, unanimously.
Wow.
Unanimously.
Okay.
I asked a doctor earlier, and that doctor had really good questions. Like, well, it would depend on side effects, how often I would have to take it, et cetera, et cetera. And I think that was I think those are things to explore. But there was a resounding yes from the men. They would take.
We ain't talking about surgeries. We just talking about pills. We
just
have somebody we got people in the chat talking about more young men are getting vasectomies. That might be
we're not
true.
even talking about that.
We not talking about that. We not talking about getting.
Well, just to be
snip,
clear,
snip, snip.
there is not currently a pill or a shot,
There isn't.
available commercially. But I'm sure there are researchers out there that are working on it. So it is a valid question, because if it does come to market, it sounds like it might be quite popular.
I think so. The brothers sound like they want to take control of some things. So
Control.
You'll have to do the remake, Wayne.
Control. Now I'm all fed up.
Well, on that note,
James Jackson.
right. On that note, thank you all. Thanks for the what y'all think for the weekly recap. We're going to be seeing y'all back in just a little bit, but we are going to transition right now to our main topic for tonight. COVID. It's over, right? Actually, wrong. We're still going through surges every summer and every winter. And we're at the beginning of one right now that has new variants that are highly contagious. And we know this because of wastewater data. So testing that happens with wastewater that we use, when we flush the toilet, you can actually track the levels of COVID-19 virus in there. And we're seeing that we're double where we were this time last year in 2023 with the amount of COVID in the wastewater. And the South and the Midwest right now are the hot spots this week. But of course, that could change pretty rapidly. And in the midst of this, I think it's really important to highlight that although we're thankfully past that phase of the pandemic where there were, massive deaths and hospitalizations, we're now in a new phase of the pandemic, or new phase of COVID, where it's silently affecting us in ways that we aren't even thinking about. And that's what inspired tonight's episode topic, which is men and their reproductive health and COVID. We're calling it Men, Sex, and COVID, what you should know. And we have an expert here with us tonight, Dr. Leslie Deane. He's a urologist and professor and chief of the Division of Urology in the Department of Surgery at Howard University College of Medicine. He has over 17 years of experience and expertise in robot-assisted surgery for the male reproductive and urinary system. Thank you so much for joining us, Dr. Deane. How are you doing tonight?
I'm very well, Dr. Mel. Thanks for having me back.
Absolutely. Yes, you are no stranger to the show, and we are delighted that you decided to join us again for this really important topic. And just to level set, not everybody knows what urologists do. So just kind of explain a little bit about, what you do and who you see.
Sure. Urologists are basically the doctors who take care of the urinary tract of both men and women. So that's the kidneys, the ureters that transport the urine down from the kidneys to the bladder, and the urethra, which is the tube from the bladder to the outside. And then urologists also take care of the male genital system. So that includes the prostate, the seminal vesicles, the penis, and the testicles.
Great. Thank you for level setting for us. And so that's going to launch us. We know that you're an expert in the urinary system and the male reproductive system. So how does COVID-19 affect the rest of the body outside of that area of the reproductive system and the urinary system? How does it affect areas like the heart and the nervous system, which might indirectly lead to effects on the male reproductive system?
Sure. So COVID, as you know, when it initially started, it was basically a respiratory disease. But we've learned over time that COVID is really a multi-system disorder, multi-system disease. It basically affects everything in the body. So this can be the brain, the nervous system tissue, including the spinal cord and the peripheral nerves. And that we will tie into how this affects male sexual function a little later on in the show, I'm sure. So we call it a neurotropic virus because it has affinity for the nervous tissue. We also think it's an endotheliotoxic virus. And by that, what I mean is the lining of all of the blood vessels are affected by COVID. And as you know, blood flow is really important for erections. Of course, the heart is the major way that blood gets to all of the organs by the many millions of beats that it gives throughout our lifetimes. So in order to get blood to vital organs, we need the heart to be working really well. And COVID can affect the heart in terms of causing inflammation of heart tissue, and that inflammation can lead to disorders of the heartbeat called arrhythmias and heart attacks, which may not be related to this traditional coronary artery disease that we would see as both men and women get older.
Mm-hmm. Right. And if it's also causing inflammation, as you said, inside the blood vessels leading to heart attacks, because it impedes blood flow to the heart, it can impede blood flow to the penis, as you said. So it can slow down blood flow to any area of the body, essentially. It can also put you at risk for strokes as well. But with the effects on the nervous system, can that also too indirectly affect the male reproductive system?
Yeah, so the nervous system basically plays an integral role in erectile function from very basic things. So, um, in order to achieve an erection, there needs to be adequate stimulation, and that comes the sensation from the stimulation comes from a response by nerve tissue. Blood
Mhm.
flow, as we alluded to earlier, is a second component, and then there's also a psychological component. And we know that COVID can increase rates of depression, anxiety. Those are things that are important in achieving an erection. And additionally, another facet that's not frequently spoken about is the sense of smell, which people lose, and the sense of
Oh,
taste, which people
wow. I had not
can
thought
lose as
about
well. Yeah, and that really,
that.
the smell of your partner is something that arouses people,
Mhm.
and that's important in the genesis of erections as well. So all of this ties in really integrally in sexual function overall.
So people might, or men, because we're specifically talking about men, might lose interest in sex and after having a bout of COVID and not even realize why. It could be linked to the sense of smell, could be linked to depression, it could be linked to loss of sensation, or it could be linked to loss of or less blood flow to the penis. All those various reasons. Um, so can COVID-19 also lead to direct effects on the fertility of men in terms of its direct effects on some of the tissues in the male reproductive system?
Yes, absolutely. COVID has been isolated from testicular tissue. So people did biopsies of testicles in men who had either died from COVID or were having treatment to their testicles in a post-COVID situation, and they found virus inside of the testicles, and that virus can have a direct effect on testicular function, either directly from the virus itself or inflammation related to release of what we call cytokines or inflammatory markers in the testicle, along with
Mhm.
cellular mediated immune responses, because the white blood cells have to come to areas of infection and they cause inflammation in those tissues.
Mhm. And this might not necessarily be something somebody feels, right? I mean, this might be happening on a very sort of under the radar level, so a man might not necessarily know that this is happening in his testicles. Is that correct?
Exactly. It can be anywhere from asymptomatic through minimally symptomatic to a person actually developing orchitis or epididymitis from the virus being in the testicle. So there's a very large spectrum of how this can occur.
So, does that then have an effect on a man's ability to? We talked about erections, but a man's ability to inseminate his partner in terms of get
Yes.
her pregnant.
Yes, it does, because we've seen from studies as well that COVID lowers almost all of the semen parameters, with the exception of morphology. So semen volume goes down, motility of
Mhm.
sperm goes down, sperm count goes down, the number of abnormal, the number of normal forms of sperm can also change. Um, while we think that this is a temporary effect and men may recover, still about 50% have prolonged or persistent abnormal semen parameters, and yes, that can impact on
Mhm.
their fertility.
Wow, so I would imagine couples that might be trying to get pregnant and don't even, again, know that this could be a side effect of COVID might not realize that that could be a factor in, not being able to conceive.
Exactly correct.
Yeah. So, are there specific symptoms related to the male reproductive system that men should watch for if they contract COVID-19?
Yes. So like we spoke of earlier, there can be a whole spectrum from minimal symptoms in the testicle to florid symptoms of orchitis and epididymitis, which basically are inflamed testicles, swollen testicles, painful testicles. The little body that sits behind the testicle is the epididymis, and that can also become very, very tender during the course of a viral infection. You may remember many years ago when people would get mumps virus.
Mumps, right? Yeah.
It sometimes could present with testicular swelling or swelling of the
Mhm.
parotid gland, the salivary gland, and this can be quite
In your
similar. It
mouth.
is
Yeah, the
in the
one
mouth.
the gland that produces saliva in the mouth. And you
Correct.
people might not remember, but people who get mumps might look like chipmunks because your salivary glands swell up. Yeah.
Exactly. And then, you may notice that the erections are less firm. It's harder to get an erection than it was before. A little more difficult to maintain the erection. And like we spoke of earlier, the changes in the sense of smell. You may be able to smell food fine. You may be able to smell coffee
Mm.
fine, but the subtle things that lead to arousal with your intimate partner, you may not realize that you're not smelling
Mm.
or appreciating those cues anymore. Um,
Right.
you know,
So, I if you do experience some of these symptoms, are there specific treatments or interventions for these, COVID related reproductive health issues that we've been talking about?
so unfortunately, there aren't any specific treatments for these issues caused by COVID specifically. We've continued to do the same things that we would for, let's say, erectile dysfunction in the general population unrelated to COVID, and
Mhm.
prescribe the medications that we would typically prescribe in that situation. I think a really big caveat is that one COVID infection can do this.
Mm.
And the multiple COVID infections that people are getting, I don't think that's going to be a good thing for long-term overall health as it relates to fertility, sexual function, etc.
Wow. Now, the irony of all of this is, when there was a big push to get people vaccinated, one of the concerns that people had was, oh, the vaccine affects fertility, right? And so I don't know where that actually came from, but it became sort of a very popular meme on piece of misinformation that was passed around on social media that led to people deciding not to get vaccinated. Are you aware of any research on the impact of COVID-19 vaccines on male fertility?
Yes, so there have been several studies looking at this over the last 3.5 years since the vaccines have been made available. The general consensus, and there was more recently a meta-analysis or an in-depth review of all of the effects of those studies combined to see
Uh-huh.
if there was a an effect from the vaccines. And the general consensus is that vaccination for COVID-19 does not result in significant changes in sperm parameters.
That's good to know. So,
Absolutely.
um, so I think, if people are thinking about getting vaccinated, that's one thing that they can strike off their list as a potential concern. I remember at the time, when we were doing a lot of shows about COVID-19, the question came up, well, I don't know what's in there. And somebody said, well, you don't know what's in tattoo ink, but you allow people to tattoo your body. And it turns out that tattoo ink can have, now I just saw a recent study, can have potentially toxic ingredients, or lead to infections. So that, I think, is very reassuring when it comes to the vaccines. You mentioned that like just one COVID infection can put you at risk, and people are getting multiple COVID infections. Are there particular men that are at risk that you could say predict might have these potential effects and should be, you know, um, more concerned than others, or is this something that it's sort of like Russian roulette? You just don't really know.
Yeah, I think it's safe to assume that every person that gets COVID is at risk. Um, we often hear, "Oh, I had a mild infection," and that may be mild in terms of the external symptoms. You didn't get really sick. Maybe you had a little sniffle. Maybe you had no symptoms at all. That doesn't mean that the virus is still not causing significant problems internally that you just
Mhm.
don't realize as yet. And we also think that the effects of multiple infections are potentially cumulative. And I
Oh,
think that
wow.
that's
Mhm.
I think that that's one thing that we really have to be careful with, especially children growing up. Young
Mhm.
boys getting 25 COVID infections before they get to puberty. Who knows what the effect of that is going to be on
Mhm.
their maturation? We just don't know. So I think that the
Right.
best course is likely to try your best to avoid infection.
Right. And I think it kind of speaks to, sort of the cavalier nature that initially some people had towards COVID after they found that, they survived the first infection, and even not vaccinated, didn't feel so bad as they thought they would, or maybe it felt like the flu, but they got over it. And so, have since then developed a cavalier attitude towards subsequent infections. I think, science is something we're constantly learning, we're constantly evolving, and we just haven't had the time with this virus to really understand everything about it. So as you said, it's kind of better to err on the side of caution till more information is available. Um,
Absolutely.
Now, you're an expert also because the prostate is part of the male reproductive system. You're expert on the prostate and on prostate cancer. Can you, first of all, tell us what the prostate does, and then share with us any effects from COVID that you are seeing when it comes to prostate and prostate cancer?
Right. So, what the prostate is it's a little gland that sits between the bladder and the pelvic floor. So this is deep in the pelvis of the body, and through that gland runs the urethra, or the tube that allows us to evacuate urine from the bladder when we urinate, or when we void. That tube has a dual function, because it also connects with the ejaculatory ducts, which come from the vas deferens and from the seminal vesicles. Those are parts of the body that convey the sperm and the seminal fluid. And the prostate is responsible for keeping that fluid healthy, and keeping it and maintaining an environment that sperm can thrive in. Okay,
Mhm.
so that's what the prostate does. Now, what we are
So
seeing,
it's like a lubricant. It adds fluid to the sperm so that you can, when you ejaculate, it's an effective ejaculate.
exactly.
Okay.
So, what we've been seeing is men come in post-COVID and they have worsening of their urinary tract symptoms. And these are symptoms that would typically be related to benign prostate enlargement. As a man gets older, we tend to urinate more frequently during the day. Maybe we wake up at night to urinate. Because the urinary tube is passing through the center of the prostate, that can be encroached on by anything that causes the prostate to enlarge or anything that causes inflammation of the prostate, and therefore the urine flow is more restricted. And we've been seeing more men come in with changes in their symptoms despite being stable on medication for a number of years. This may be cause and effect, or it may be unrelated. It's just an observation that many of us have had. Um, the more important thing with regards to prostate cancer, though, is that we seem to be seeing a lot of aggressive prostate cancers.
Wow.
And they are men who have had, for example, surgery several years ago, who had undetectable PSAs, and the PSA is the prostate specific antigen. It basically is the blood test that we use to give us a suspicion of whether a person is at risk for or has prostate cancer. But more importantly, we use it to follow patients who have had definitive treatment for prostate cancer, meaning removal of the prostate or radiation therapy to the prostate, so that when a person has had their prostate removed, we expect that the PSA level will now be lower than the
Right.
detectable level on the test. Um, Historically, I had seen a number of men who had a bad cold or flu around the time of drawing the PSA blood test, uh, and they were following surgery, and their PSA had been undetectable, but the blood draw happened shortly after or while they were sick, and you see a little bump in that blood test, but almost uniformly it would go back to undetectable levels.
Right, and so
With COVID,
this you're not talking about COVID. You're talking about your
correct,
garden variety cold, the
yes,
flu,
correct.
pre-COVID viruses that were that everybody gets. Right.
Exactly. And when we saw a little blip in that PSA number, I would repeat the test 5, 6 weeks later, and almost invariably it would go back to undetectable. It was a
Okay.
cause for alarm, but we
Mhm.
allay people's fears that it's now undetectable again.
Right.
With COVID, however, it seems that men who have been disease free for a long time, their PSA takes a bump after the COVID infection, and
Mhm.
it does not go back down like we
Wow.
saw with the flu. Essentially, it is a biochemical recurrence, what we call a biochemical recurrence of the prostate cancer, and that number keeps rising. So essentially, what it appears to be is that an individual whose immune system was able to keep the few cells that were still in the body not producing enough PSA to be detectable on the test. Now the immune system has been affected from COVID,
Mhm.
inhibiting that immune surveillance that kept cancers in general at bay. Um, and it's going to be really interesting to see how this pans out. Because I think this is one of the more serious consequences potentially of
Yeah.
COVID virus infection.
And I'm not only hearing that just with prostate cancers, I'm also hearing that with other kinds of cancers too. I mean, in
Yes,
our weekly recap, we were talking about cancers. I talked about, the role of the immune system. Every day we have 100,000 cancer cells pop up in our body, but if we have a healthy immune system, we don't all get cancer. It eliminates them. So it's almost like a bait and switch. Like COVID is like over here, saying to the immune system, "Hey, I'm going to tie you up over here so you can't do your job." And it seems like that's having long-term effects.
yes,
Wow, that's a lot. I mean, my eyes have been opened. I'm sure our listeners probably have lots of questions, and they're probably like, oh my God. So I'm going to have Wayne and Lila come on back and see what's in the chat, see if our audience has put any questions or concerns there that they want to pose to Dr. Deane.
Wow. This is really, really interesting. And I don't know what you're seeing on your side, Wayne, but I do wish I could see more men in the Facebook chat, but maybe there are men out there watching, and I hope so. So ladies, I said this in the chat, make sure you invite your men folk, your family, your friends to watch this, because it will be up on social media. Watch it again. I have one question, and this is for both doctors. So I heard you say, Dr. Deane, that one COVID infection could cause or wreak this kind of havoc on the male reproductive system. Would we consider that a symptom of long COVID or just a byproduct of having had the COVID infection?
So long COVID basically relates to a whole constellation of symptoms as a result of COVID infection. So the answer in simple terms is yes, this could be considered a consequence or a feature of long COVID, because it is a persistent symptom that arose after a COVID infection.
Okay.
Wow. Thank you.
But we did talk about several things. So Dr. Deane did mention that you can have, for example, painful swelling of the testicles and effects on your fertility. That initial painful swelling, that could be considered an immediate effect of COVID. But if it lasts a long time and you have long-term effects from from it affecting your semen count, your sperm count, your semen availability, and it lasts a long time, that I imagine would then be in the symptoms of long COVID and the constellation, one of the things that could be considered long COVID.
Okay.
Well,
Correct.
I think
remember.
Go ahead, doctor. I'm sorry.
No, I was saying, remember also that in addition to the sperm production function of the testicles also contain cells that produce testosterone. So when the testicles are affected by COVID, it can result in a decrease in the testosterone, which in several men, it doesn't recover to levels that we would consider normal. So it means then that you're at risk for losing muscle mass, losing bone density, mood changes, erection problems as a result of low testosterone as well. So, once again, this is something that I don't think we should be cavalier about
at all. I wanted to tell Lila, I think her cry was heard, definitely. We have our next question comes from Michelle Walker Scales. Is there evidence that the vaccine prevents or curbs the side effects of COVID in men?
So I think that generally speaking, vaccination has been shown to decrease potentially the severity of COVID. And we probably can extrapolate that to indicate that the outcome in terms of men's health would be better with vaccination. It's hard to prove that, though, because of the prevalence of COVID in the society and the number of people that get COVID and how many times they get it.
Okay. And I'd like to also add too that when you get vaccinated, it does actually protect you from contracting COVID initially. Let's say for the first anywhere from 8 to 12 weeks, maybe even up to 4 months, but generally 8 to 12 weeks. After that, that bump that you initially get, that protective bump goes away. But then if you do get COVID anytime in there, the effects of COVID are less serious. And also there is research to say that therefore the rate of long COVID goes down. But I haven't seen specific symptoms like what we're talking about. Does it affect the rate of some of these complications in the male reproductive system? I just don't know if the research has been done yet.
Mm-hmm. Yeah. Couple things. This question comes from Carolyn Lawrence, and it's about men over 40. What preventative measures or lifestyle changes should men of color over 40 consider to mitigate any increased risk or adverse outcomes related to COVID-19 as far as urological outcomes?
So I think that's a really important question again. And, this all relates to doing healthy things, exercising, decreasing smoking, decreasing alcohol intake, eating healthy foods, including a lot of fruits, a lot of vegetables, potentially minimizing fried foods, high cholesterol diets, high salt diets. Avoid those latter two. Exercise, very important. Maintain the weight. If your family is at risk for diabetes, make sure that you're not doing things that increase your risk of developing diabetes, and as a result, high blood pressure, high cholesterol, etc.
Okay. I just want to answer Ann Lawrence's question in the chat. She asks, is COVID on the rise currently? Yes. And we're having a surge again. I want to put a question up by our West Coast producer, Rhoda Lawrence. She asked, do you find
before you do that, I just want to emphasize what I said earlier, that every summer and every winter, we've been getting COVID surges. So we are currently at the beginning to middle of the summer surge. So.
Okay. Want to go back to our question from our producer on the West Coast, Rhoda Lawrence. Do you find that most men wait too late to get the prostate examination, and what's the approximate age for an exam?
Good question.
Yes. So men should start getting tested at age 50. And that goes to age 60, 69 or so. Per the American Urological Association guidelines, men who are at increased risk, such as African American men, and other men who have a family history of prostate cancer, either in their father or a first degree relative like a brother, or people who have breast cancer in the family, in the women in the family, they are also at risk for developing prostate cancer and should be screened earlier. Generally speaking, that will happen at some point in the 40s. So if you get a baseline PSA test done just after you're 40, and that number is very low, then you can tailor the screening interval to much less frequently than annually, once you establish that the number is low. And I think that goes for pretty much every man, but men who are at increased risk should start in their 40s.
And I just want to put a punctuation mark next to a couple of things you said. The family history of prostate cancer, but the family history of breast cancer in women in your family. So women who are watching, who may be aware of family history or history of breast cancer in yourself, let your men know who are related to you that that's an important potential risk factor that would lower the age at which they should start screening.
And I want to, were you going to say something, Dr. Deane? Because I want to piggyback on what Dr. MEL said.
Yeah, that's related to the BRCA genes, to the BRCA genes. So if there is a woman in the family with hereditary breast cancer or ovarian cancer, that increases the risk for the men in the family for prostate cancer.
So important to know. And you said something that I think is hugely important. And that's what this show is all about. People being empowered to manage their health, right? To know how to advocate for themselves, getting a baseline on your PSA, fellas. So that as you continue to get older, you're watching what's happening with that. I think that's really, really important. And not just fellas, that, you know, a lot of that falls to us women who are scheduling appointments and whatnot and encouraging those things. So thank you.
That's right.
Exactly. There is another question in the comment. I cannot pronounce their names. I'm sorry, but when you hear your comment, you'll know it's you. Anyway, are there any specific disparities in how COVID-19 affects the urological health of men of color, or as opposed compared to other groups? And if so, what are the factors that contribute to these disparities?
Yeah, so I think that by and large that is yet to be seen. We know that African American men right now have a higher rate of hypertension, have a higher rate of cardiovascular disease, higher rate of diabetes, and introducing COVID on top of that and multiple COVID infections stands a very good chance of causing those conditions and the related issues to those conditions to be worse. So I think that we can infer that the effect of COVID is going to be more on the Black population.
Okay. Wow.
I'm sorry, this is not a good news episode, y'all.
This is not a good news episode.
So important.
But it's important information. Yes.
Very important information. And I probably was had when you started talking about young people and kids, and we won't know the effect of it, of them getting multiple infections over years. I mean, you know, children now who are 11 and 12 who got COVID when they were 8, 9, 10, 11, 12, and could get an infection every year, until they're 21.
That's true. Yeah.
Yeah. And that's a real fear, you know, because we don't know what it's going to do to kids, right? We really, I think, have to strive to prevent folks from getting COVID, because who wants to say 10 years from now, wow, we didn't know.
Right. And I think, you know, the full court press is off, and there's still things that we could be doing, you know, in schools to make sure that ventilation is optimized, right? And that just the balls have been getting dropped because, you know, we've moved on to the next thing. So yeah, I think nobody's talking about this. I think it's really concerning that from a public policy standpoint, we're still behind the 8 ball.
It's crazy. I said this on our last show. I went down to New Orleans for Essence Fest, and you know, I was one of maybe 5 people on the plane with the mask on. I could count on one hand how many people were masked up in the convention center. We have to do our part. This thing is not going anywhere, apparently.
Yeah,
I think that's a critical comment that you just made. I will not get on a plane and go into an airport unless I'm wearing a mask. And you know, there are people all over the airports, all over the planes, coughing, sneezing, and I just don't want to be sick wherever I'm going to. You know, it can ruin vacations, ruin conferences, all of these things. So, you know, masking definitely prevents folks from getting COVID. And when you may remember that when we were all masking in 2020, or the majority of people were masking, nobody got the flu. It disappeared.
Right.
Even
there you have
allergies
it.
disappeared.
Yeah,
exactly.
That
part. I think just I want to know, just personally, what preventative measures or lifestyle changes a man over 40 should consider to mitigate the increased risk of adverse urological outcomes, adverse effects from COVID-19? What can we do preventatively?
Right. So I think the best, some of the best advice is to maintain an ideal weight, exercise, as best you can, eat as healthy as you can, and avoid situations that put you at risk for catching COVID. There are mitigation measures that we can take. Dr. Mel mentioned ventilation. Ensure that places that you go are well ventilated. Ensure that if you are with close family, close relatives, that everyone has taken some precautions so as not to risk other family members getting COVID as a result of their own actions, and in the appropriate circumstances wear a mask. I think that wearing a proper mask properly, if you are going to the grocery store, for example, I don't see a reason why people can't wear a mask, because it could change the outcome for you. Even if you get COVID, you may not get infected with as large a dose as is required to make you very sick. And there's this old adage that an ounce of prevention is worth a pound of cure.
Mhm.
I think it's worth way more than a pound of cure.
Yeah. Exactly.
So
Exactly.
we're right at the end. I have one more question, but I'm gonna let it go. Turn it over to Dr. Mel.
All right. Well, to whoever that last question was from, apologies, because we do have to wrap up. This has been just eye-opening and enlightening, Dr. Deane. Thank you so much for being a part of this episode and for bringing all this wisdom and knowledge with you and sharing with our Be Health Empowered audience. Thanks again, of course, Lila and Wayne, for making it flow and for bringing in all the comments and the questions. And of course, thank you to my Be Health Empowered family. Y'all are the best. Y'all ask the best questions. And I can't wait to see you next time. And until then, remember, be wise, be well, and be health empowered. Thanks so much for joining.